Calcitrate is a medication that is used to prevent or treat low blood calcium levels in people who do not get enough calcium from their diets. It may be used to treat conditions caused by low calcium levels such as bone loss, osteoporosis, weak bones, osteomalacia/rickets, decreased activity of the parathyroid gland, hypoparathyroidism, and a certain muscle disease, latent tetany. Calcium plays a very important role in the body. It is necessary for normal functioning of nerves, cells, muscle, and bone. If there is not enough calcium in the blood, then the body will take calcium from bones, thereby weakening bones. Having the right amount of calcium is important for building and keeping strong bones. Calcitrate may also be used in certain patients to make sure they are getting enough calcium, such as women who are pregnant, nursing, or postmenopausal, and people taking certain medications such as phenytoin, phenobarbital, or prednisone. It is important to take the recommended dosage of calcitrate as prescribed by your healthcare provider. The best time to take this medication is usually with meals. Be sure to follow your doctor's instructions for the best results. When taking calcitrate, it's important to remember to take it with food, unless it contains calcium citrate, in which case it can be taken with or without food. Make sure to follow the directions on the package or as directed by your doctor. For the best absorption, if your daily dose is more than 600 mg, divide your dose and space it throughout the day. If you're using the chewable product, be sure to chew it well before swallowing. And if you're using the effervescent tablet, allow it to fully dissolve in a glass of water before drinking it. Don't chew or swallow the tablet whole. For the liquid product or powder, be sure to measure the medication with a dose measuring spoon or device to ensure you get the correct dose. Don't use a household spoon. If the liquid product is a suspension, be sure to shake the bottle well before each dose. To get the most benefit from calcitrate, it's important to use it regularly and take it at the same time each day to help you remember. If your doctor has recommended a special diet, it's crucial to follow it to get the most benefit from this medication and to prevent serious side effects. And remember, don't take other supplements or vitamins unless ordered by your doctor. If you think you may have a serious medical problem, be sure to seek medical help right away. If you experience constipation or an upset stomach while taking calcitrate, notify your doctor or pharmacist. It's important to remember that your doctor has prescribed this medication because the benefits outweigh the potential side effects. Most people do not experience serious side effects while using calcitrate. However, if you do have any serious side effects such as nausea, vomiting, loss of appetite, unusual weight loss, mental or mood changes, bone or muscle pain, headache, increased thirst or urination, weakness, or unusual tiredness, be sure to inform your doctor right away. While a serious allergic reaction to this drug is rare, seek medical help immediately if you notice any symptoms such as rash, itching, swelling, severe dizziness, or trouble breathing. If you experience any other effects not mentioned here, consult your doctor or pharmacist. Before starting to take calcitrate, it's important to discuss any allergies with your doctor or pharmacist. This product may contain inactive ingredients that could cause allergic reactions, so it's important to get more details from your pharmacist. If you have high calcium levels, kidney disease, little or no stomach acid, heart disease, pancreatic disease, sarcoidosis, or difficulty absorbing nutrition from food, it's important to consult your doctor or pharmacist before using this product. Some sugar-free formulations of calcium may contain aspartame, so if you have phenylketonuria, PKU, or any condition that requires you to restrict your intake of aspartame, it's important to consult your doctor or pharmacist about using this drug safely. If you are pregnant or breastfeeding, it's important to consult your doctor before using this medication. As for the daily dosage and optimal timing, it's best to follow the instructions given by your doctor or pharmacist for the best results. It's important to be aware of potential drug interactions with calcitrate, as they can change how your medications work or increase your risk for serious side effects. Some products that may interact with calcitrate are digoxin, cellulose sodium phosphate, and certain phosphate binders such as calcium acetate. Calcium can also decrease the absorption of other drugs such as bisphosphonates, tetracycline antibiotics, estromostine, levothyroxine, and quinolone antibiotics. It's best to separate your doses of these medications as far as possible from your doses of calcium. Ask your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. Check the labels on all your prescription and non-prescription/herbal products, such as antacids and vitamins, because they may contain calcium. Ask your pharmacist about using those products safely. Remember to always consult your doctor before starting, stopping, or changing the dosage of any medicines. If someone has taken too much calcitrate and is experiencing severe symptoms like fainting or difficulty breathing, it is crucial to seek immediate medical assistance. In the U.S., you can call the local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of an overdose may include nausea, vomiting, loss of appetite, changes in mental or mood, headache, weakness, and tiredness. When it comes to getting enough calcium in your diet, there are several options to consider. Dairy products like milk, yogurt, cheese, and even ice cream are great sources of calcium. Additionally, dark green leafy vegetables such as broccoli, spinach, and bok choy, as well as calcium-fortified foods like orange juice, can also provide the calcium your body needs. In order for your body to properly absorb the calcium, it's important to make sure you're getting enough vitamin D. Foods rich in vitamin D include fortified dairy products, eggs, sardines, cod liver oil, chicken livers, and fatty fish. Your body can also produce vitamin D when you're exposed to sunlight. If you're taking calcitrate, your doctor may recommend medical tests to monitor your calcium levels. It's important to attend all medical and lab appointments and consult your doctor for more information. As for the daily dosage and the best time to take this medication, make sure to follow your doctor's recommendations for the optimal benefits. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. It is important to store calcitrate at room temperature, away from light and moisture. Avoid storing it in the bathroom and make sure to keep it out of reach of children and pets. Remember not to flush calcitrate down the toilet or pour it into a drain unless instructed to do so. When the product is expired or no longer needed, it should be properly discarded. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.